So our first speaker of today is Anna Prytherch, and she is the project manager of the Rural Health and Care in Wales, and she will be giving an overview of the challenges facing and the benefits derived by people living in rural areas of Wales. Anna, the floor is yours.
Thank you. Hello everyone, and thank you for the invitation to talk. I'm calling from Wales in the UK, and I'm in charge of an initiative called Rural Health and Care Wales, which was set up by the Welsh Government back in 2014. There's some background. I've got a lot of slides here, and I'm aware that I'm time constrained, so I've been told that all delegates will be receiving a copy of the slides, so I won't be going through everyone. There's a bit of background. Like I said, we were started by the Welsh Government, who had identified a need for the region that is the dark region there, that covers a huge expanse in central Wales, which is very sparsely populated. I got the figures on the left, so it's between 22 and 45 people per square kilometre. And the red dot you see alongside the name Aberystwyth is the only district hospital that covers the whole region. And the yellow dots are community hospitals, so they offer very basic healthcare services, but then linked to a district hospital, which is in Aberystwyth, and then the tertiary hospital that deals with the more complex medical needs are very much based in the south and the north of the country, so there's none in the middle, as you can see. We were set up with a vision by the Welsh Government to look into issues affecting rural populations in terms of health and care, and they're listed there. So we do a lot of research, and we look at recruitment issues, because being in a rural area we find it very difficult to recruit staff and consultant-led specialists to the region, and we do seminars ourselves and we do conferences. So these are statistics affecting rural health in the UK, and these go back to 2017, but unfortunately they are still the latest statistics that we have. So there are some benefits, that life expectancy is higher, infant mortality is lower, and well-being measures are also higher in terms of life satisfaction, people feeling that they're having a worthwhile lifestyle, their happiness score is slightly higher, and anxiousness is slightly down. So those are the benefits. However, there are a number of challenges, some of which I've touched on, and you saw the map and you'll see there are a lot of GP surgeries across the region, which was quite large. Spans 3 counties, 3 health boards, but access to GPs is one of the issues, and also recruiting GPs to those surgeries has been a huge issue. So those are general practitioners, the family doctor. I've pointed out the fact that there's only one district hospital, just small community hospitals supporting that. Then transport links to healthcare services and broadband infrastructure. Access to the internet is restricted in a lot of places, and with recent move in particular during COVID to online consultations, that has been a big issue. So those are the logistical issues, and the demographics as well. You've talked about elderly people. We find that in the rural areas of Wales we have a lot of young people moving out, and I'm sure this is common across the whole of Europe. So proportionately we have an elderly population with complex needs. We have a recruitment and retention issue. There is the issue also of people sourcing local education and training, and through research it's been proven that wherever people, health and care professionals, train, a large proportion then tend to stay and work there because it's familiar, because they have an affinity to it. And that's one of the initiatives that I'll talk about in a minute that we try to instigate in Wales. And then also that being a generalist is often considered maybe less attractive than being a specialist, and in a rural area you have to be a generalist, and that you have to have a lot of skills that you can apply. You don't always have a specialist that you can turn to if you're a health or care worker. So the opportunities that we've had to kind of instigate in rural areas to address these needs are looking at new roles. whether they're roles that you have in Europe, I'm not sure, but we have physician associates now, we have pharmacy associates, you have nurse practitioners, so it's bridging the gap really between different levels of professionals in healthcare. There is an issue with delivering care in the community, and in Wales there's a big strategic drive to integrate health and care. And also to try, I know it was mentioned earlier, to ensure that people are able to stay and live happy and healthy lives in their own homes as long as possible. And also we've been working a lot on the prevention agenda for that very reason. So some of the initiatives I've just touched on there, there's the Cardiff University School of Medicine, which is based in South Wales, and they do a scheme called Carer, where they place third-year medical students in rural GP practices for a lengthy period of time, between 9 and 12 months, to try and encourage them to consider working rurally, and that's been very successful. Swansea University do a postgraduate medical course for doctors who have already done a previous degree, not necessarily medicine, and then decide that they want to become a doctor, and they're doing a very similar course where there are longitudinal clerkships and medical students placed in rural areas to try and encourage them to then go and practice there. We're trying to reinstigate a Mid-Wales School of Nursing, and Aberystwyth University is looking at putting in a bid to do that in the NEC by 2022. Integrating the training opportunities for health and care professionals, because there's so few of them in rural areas. We're trying to ensure that there's better integration and collaboration so that they can share some training modules, and that there will be flexible career pathways between health and care. So it's not necessarily you choose a career in health or a care, that it could be that you could flit from one to the other. We've done a number of research onto green, blue or social prescribing, which is again linked to the prevention agenda. Looking to get people to become more responsible for their own health. I think there has very much in the UK and in Wales in particular been a dependency culture, whereas people are ill and then turn to the medical or health professionals to address issues, problems, as opposed to taking ownership of their own health and care and doing more. And I think, you know, that's been a big outcome of COVID, is this emphasis on outdoor activities, which is great for well-being as much as health. We run a trial project which is looking at developing strong communities in terms of, it's not specifically health or care, it's more care related, but it's looking to instigate teams of volunteers working in communities with an appointed coordinator to match the elderly people with volunteers who will support them to enable them to live longer in their own homes by taking them to medical appointments, maybe doing their shopping, taking them out, providing company, even basics like helping with the gardening or cleaning, or just somebody at the end of the phone to talk to. And we've done a lot of work in recruitment, trying to attract professionals who are looking for more of a work-life balance. So the emphasis being on, in rural areas, you've got the open green spaces, the sea, you know, you can come here and work and be on the beach in 10 minutes. And COVID, I've mentioned COVID a few times, it's had a huge impact on rural health, and I think it will have an ongoing positive impact in years to come, because a lot of people from urban places, including health and care professionals, are now considering moving to rural areas to have a better work-life balance and to be more accessible to the green spaces that are around. So the third point there you can see is on recruitment. There's been a 25% increase in the number of applications for people looking to do nursing degrees in Wales this year. There's been a significant increase. I haven't got the exact figures, but there's more than double the amount of applications for people wanting to be doctors than we have got places. The safety in Cardiff, for example, the numbers of people with COVID are significantly lower than national and international figures, and that's been very attractive to people looking to move to the area. And because of the move to a lot of people working from a home, the it was an issue that medical professionals moving to the area were hindered because there was no opportunities for their partners or spouse who might be working in different industries. But now that's been alleviated with the opportunity for a lot of people to work from home. We're finding that a lot more people and job applications for health and care roles have increased significantly across the board as a result of that. Telehealth has been I've seen huge progress here in Wales. There's always been a slight reluctance to do the online consultations, which are essential for rural areas. But now there's software being implemented nationally called Attend Anywhere, which provides online consultation with GPs and consultants, which has been a huge benefit. Today we're talking on Microsoft Teams, all the NHS, which is the National Health Service in Wales. Prior to COVID, we did not have the means. It was always a problem, particularly in communicating with academic institutions, etc. We would be reliant on Skype or internal comms, but now everybody's adopted Teams, which has been fantastic. And like I said, everybody's been supported to do more home working with remote interventions as well, in terms of support facilities being set up in village halls, etc. The other impact has been, I said, that there is a drive to integrate health and care, so there's this seamless transfer of patients from medical centres back to their home or vice versa. And in Wales, the healthcare sector is managed by the National Health Service, whereas the care sector, excuse me, is more reliant with local authorities administer that, so that's governmentals, and every county has their own budget to deliver care services, and there's always been a bit of a disconnect because data isn't shared and there's been delays. Well, since COVID, they've set up these command groups across all regions of Wales, and they have different tiers, gold, silver and bronze, but both the health boards and the local authorities sit on those, and it's provided a fantastic service and a more seamless service. So that seems to be working, and I'm sure that is something that will continue post-COVID to the benefit of rural populations. I've then given, like I said, I'm very aware that I'm only supposed to be talking for 7 minutes, so I will wrap it up in a minute. But I've just given here on the next few slides just a sample of some of the projects which are slightly different to your traditional health and care ones that we've been running in Mid Wales just to address health and care issues for rural populations, particularly the elderly. And this was a social prescribing one that we run with a GP cluster in North Ceredigion. That supported people by enabling the GPs. They were saying up to a fifth, so 20% of patients going to GPs were presenting themselves with problems that weren't medical. They were more social and very much based on loneliness, mental health issues, etc. And these were then being referred to a link worker who helped them with social prescribing, which was connecting them to local voluntary groups or activities in the local area that they could participate in. Again, as I said previously, we very much emphasising the preventative agenda, and also shifting the onus for a person's health and well-being for them to become more responsible themselves, as opposed to looking to the medical profession to medicate them for depression, for example. So we were trying different initiatives, and that's proved very popular, and as a result a link worker has been taken on board permanently after the project ended. This is another one we're looking at obesity really in 14 to 25-year-olds, particularly in the agricultural community across rural populations. This has been a problem, and trying to get young people between the age of 14 and 25 to embrace outdoor activity with health and well-being benefits. So this was an European project that we did that inserted static bikes that charged mobile devices. So we're trying to incentivize young people to do outdoor activity by linking it to something that they were using regularly. So it could be mobile phones, it could be iPads, whatever, and you can link them to this bike, and it's people power. So it also is environmentally friendly. And that one's in the process. We've done the consultation with over 700 young people across the whole of the rural area, and we're about to install these bikes. We'll be doing further research then into the use and the health and well-being benefits of them. And another example is we talked about community resilience, that team of volunteers. We've had funding to trial this in a small town that based on the Solver Care model. And I think if you're interested in this community type resilience project, if you look at Solver Care, it'll tell you all about it. That's a scheme run down in Pembrokeshire, but we're trying to emulate because they developed a toolkit how it could be rolled out to other regions. And that's another project that we have ongoing at the moment. We've also reviewed health and care services across the whole of the North Wales patch. So that's slightly out of our patch, but it's still a huge area that is rural. And this is looking at different delivery models of care. And from this we identify 6 best practice models from an international perspective and drove these down to 3. And then worked with the North Wales Workforce Board to trial the favourable 3 in North Wales, and that part of the project is ongoing. We also did a data and survey analysis of how people are receiving care and the spend, etc. What we also do, and I just wanted to flag this if anybody from SAFI ever wanted to attend, we do an annual conference, and last year it was online, so we do try and do very similar to SAFI, share best practice and get people to learn from each other. And that's just an example, and those are my contact details. I'm sorry it's a whistle-stop tour of quite a large subject, and it's you know, I could go on and on for a very long time, but are we all still there?
Unfortunately, we don't have any time for the questions now, but I hope you can stay after till 1 because I have some questions for you. But now I will let a word to Jolien. Thanks a lot.
Perfect. Thank you, Cynthia.